Hello, I'm Dr. Farah Fathima from St. John's Medical College, Bangalore. I am a teacher in a medical college, a primary care doctor, and a part-time researcher. I am here to share with you the story of my leadership project, which is called Flowing Freedom. Menstruation is a fundamental aspect of a woman's reproductive years. Yet, in lower and middle income countries, many women face challenges. Rural women especially lack access to effective, affordable, and safe menstrual hygiene management methods. This impacts their physical, social, and mental well being due to insufficient support, lack of knowledge, and the prevailing taboos. So, what menstrual products do women in rural areas use? Some of them have access to sanitary napkins. Many of them use cloth pads which have to be washed and dried and often hidden in view from the society. Is there a viable alternative? Menstrual cups are made from medical grade silicone. They are gaining acceptance as a safe and sustainable menstrual hygiene method alternative at a global level. They are reusable and cost effective. They reduce the risk of irritation and infection. They preserve the natural moisture and prevent dryness and discomfort and enable women to take charge of their reproductive health, challenge societal norms and showcase agencies. But unfortunately, not many women know about it. Creating awareness and improving access to affordable menstrual hygiene solutions is crucial to women empowerment. The objective of our leadership project was to study the effectiveness of a health education campaign on menstrual cups among women in rural areas of Sarjapur. This intervention was led by community health workers who are the backbone of our work. These are women who have worked with us for the last many years and they represent the local community. Through the community health workers, we reached out to married women aged 18 to 49 years who are members of local women's self-help group. So the community health worker led health education package on menstrual cup was delivered, and different topics like need for menstrual cup, understanding the different parts, shapes and sizes along with visual aids, choosing the right size of menstrual cup, basic features of female anatomy, insertion and removal techniques, cup sterilization methods, and the benefits of menstrual cups were delivered to the women from self-help groups in an interactive mode using charts and models. We received a grant of rupees 10,000 from the local Gram Panchayat, which was spent on procuring menstrual cups that were distributed to the women. This is the description of the 108 women whom we were able to reach out to. They were aged around 35 years, were married for almost 15 years, had a formal education of close to 10 years, and were participants in women's organization groups for 6 years. They belonged to non-nuclear families, and 17% did not have access to a sanitary toilet. Their median family income was 15,000. 41% of them were homemakers. 23% of them worked outside house, whereas the remaining worked within the house in some gainful occupation. Among those who worked, the median self-income was 3,000 rupees. This graph shows us the menstrual product use before and after the intervention period, after a follow-up period of 3 months. At baseline, we found that majority of the women use sanitary pads. However, some women used cloth pads also. We saw a major change after intervention. While before intervention, none of the women used menstrual cups, we saw that around 50 women had started using menstrual cups, and another close to 40 women had at least tried out menstrual cup. There was also a decline in the number of women who used cloth pads. What are the reflections from this project? Menstrual cups are a viable alternative with many health and environmental benefits. Many myths were busted and many misconceptions were cleared as a part of the health education session. We still have a long way to go. We encountered some challenges and we realized that mindsets need to be changed. We realized that stakeholder engagement is very crucial for the successful implementation of any project. We also realized that women are very powerful agents of change in the community. But for me personally, the most important happiness is when I see the twinkle in the eye of a woman who has become a menstrual cup user. Have I changed over the last 1 year? Most certainly. I have learned about different leadership frameworks. I have interacted with many wonderful ladies. I have shared my stories with them and I have heard their stories, made a lot of friends. I have introspected a lot using the assessments and the reports that were shared during the project and the coaching and the mentoring session. I learned about the 3 C's from my uh, mentor, Dr. Madhuri Kanitkar. She said, women are competent, they are confident, but what we lack is courage. And I have picked up the courage as a part of this leadership journey to lead and to improve myself every day. From a teacher, a primary care doctor, and a part time researcher, I can proudly say that now I'm evolving into a leader.